Hi, I'm Shannatay Bergeron with Colorado Mountain Medical, and today I have with me Dr. Rebecca Adochio, board-certified endocrinologist, and we want to talk about diabetes. One misperception I know that I have is that diabetes doesn't really exist in our community because we're so healthy. So Dr. Adochio, can you give us some insight into what types of diabetes there are and what the prevalence is in our community?
Absolutely. Thank you for having me today. Diabetes mellitus, which is a condition where blood sugars become inappropriately elevated in the body, comes in a few different forms. The two most common forms are what we refer to as type 2 diabetes, which may have a little bit more awareness throughout the country, often associated with obesity, less healthy lifestyle, maybe more sedentary lifestyle. But there's also another type called type 1 diabetes that many people associate with what used to be called juvenile diabetes. We don't call it juvenile diabetes anymore because we can diagnose it really at any age. And in our community, we certainly see a lot of new onset forms of type 1 diabetes, even at the age of 40s, 50s, and 60s. Diabetes is prevalent throughout Colorado, even though we are one of the healthiest states in the country, particularly up here in the mountain communities. But there's getting close to about 500,000 individuals within the state of Colorado that have some form of diabetes. Additionally, there's about another 500,000 people that may have prediabetes and not aware that they're at risk to develop full onset diabetes mellitus.
Those are some surprising numbers given our healthy community. So just because you're healthy doesn't mean you couldn't have type 1 or type 2, and it might come on later in life. So what kind of education is Colorado Mountain Medical in your practice offering to our community for these new diagnoses that people might have?
Sure. Well, we really pride ourselves in being a comprehensive diabetes center. We have lots to offer our patients. One of the most important factors when treating patients who are living with diabetes is education. And diabetes is a condition that really the individual is managing often on their own at home. We're not there with them. And so the more we can educate them about their disease, how to manage their disease, how to manage a complication or a bad day, the better they will be and the more in control they can feel about their condition. So we have a pretty extensive education offering. We have an in-house diabetes educator and clinical specialist. Her name is Annegret Kessler, and we're actively engaged in achieving an advanced certification with the American Diabetes Association to have a diabetes self-management and education support program. We also do a lot of education throughout the community. We do some community outreach to help individuals identify if they may have diabetes or how to be aware of the new nuances on symptoms that may be related to high blood sugars. And we're also engaged in diabetes programming for healthcare providers, clinical support staff, primary care doctors, so that they know how to empower their own patients to manage diabetes as well.
So that is a lot. With a new diagnosis, it sounds like there's a ton of education that comes with it, or even if you've been living with it for a long time. Do we offer other things like behavioral health services or partner within our organization that the patients could utilize to maybe not feel like they're having to manage this diagnosis alone?
Absolutely. We're thrilled about the growing behavioral health programs in our community. There's actually some astounding statistics around depression and patients living with diabetes. If you have type 1 diabetes, you're 3 times more likely to have depression than someone without diabetes. And those with type 2 diabetes are actually 2 times more likely to have depression. So it can really become a barrier when we're trying to help patients feel good about themselves and their body and really be able to take control and do all the necessary steps to take care of their health if they're depressed or if they feel like there's not a way to manage it. So we're engaging actively with our behavioral health specialists, and the American Diabetes Association offers a specialty certification for mental health care providers where they can learn a little bit more and dive a little deeper into what those individuals who are living with diabetes are struggling with. If we can get past those barriers, we can achieve a better level of health for them.
This is all incredible. So amazing to hear how we're combining medical and behavioral health to try and care for our patients' overall well-being. So thank you for the great information and being here with us today. Visit us at cmmhealth.org for more information.